Here's the thing with Luigi Mangione, right? He was driven by this ideology. You could even argue to some degree was politically motivated. His feeling was, I've suffered from back pain, a bunch of surgeries. I've suffered because of the lack of efficiency in the healthcare system. So he thought he was justified in going out and murdering this UnitedHealthcare CEO. And what did you find? You find that there were some people that cheered for him. Matter of fact, today, outside the courthouse, there were dozens of people out there cheering for him because they didn't slap him with the terrorism charge. And so it's this glorification of vigilante justice. We see this similar situation with Charlie Kirk, where you have a lot of people up on social media celebrating his death, which is terrible and tragic. But, what we're finding, it seems like in the United States, especially over this last year in 2025, is there are groups of people that believe that they are justified to commit these terrible, heinous acts, like what happened with Luigi Mangione, what happened with Charlie Kirk, and that they're justified by it based on these ideological or political motives, right? And we see, again, this idea that, it's okay for me to do this because I'm kind of bucking the system. And actually, I was watching some interviews of the protesters outside the Luigi Mangione case, and that's what a lot of them said. They said, well, you know what? He deserved that, the healthcare CEO, Brian Thompson, because the healthcare system is so screwed up in America. So there seems to be this warped or twisted idea that there's a justification in going after people, even being violent, right, to the point of murder, if they disagree with you ideologically or politically. And to me, that's insane.
Dr. Soliman, what role do you think, if any, social media is having in maybe kind of accelerating the shift in attitudes that we're seeing?
That's a great question. I think it's creating a lot of polarization, number one. Number two, I think it's creating a lot more focus, right, in an intense way on these issues. I mean, if you think about it, back, 20 years ago, you watched the news at 5 o'clock at dinner, and maybe you watched it in the morning when you were getting ready for work or school, and that was it. But right now, we're in a 24-hour news cycle where you're getting information from the internet, on TikTok, on Instagram, right? You're getting on your social media, and it's continuous. It's nonstop. So that nonstop feed of information can, in some cases, like what happened with the murderer of Charlie Kirk, radicalize those individuals, right? Because they're constantly hearing that information over and over and over again, all throughout the day. And the other problem, too, I think, is that there's no filtering system for information that's accurate versus misinformation. We see with the Charlie Kirk situation, there's a bunch of conspiracies now, right? And so there's really no way to substantiate what's real or what's not. So I think, this is one of the concerns, right, with the use of social media. And I think, we have to figure out how we balance that with, our First Amendment rights of free speech, right? Because you don't want to stifle people's ability to express their opinions. But in some cases, when those opinions go so far that they can lead to violence potentially, I think that's where we got to draw the line. So I think, this is a new area that's evolving. Obviously, the Charlie Kirk murder, from my perspective, represents almost like a new era when it comes to violence and political violence, because technically he wasn't a politician. He was really an influencer who had begun the Turning Point organization, and he was assassinated. And we saw the fallout out of that. So what is that going to mean now for other influencers or other people that share their opinion? So I think we got to be very, very careful about glorifying this vigilante justice, which, like I said, I see the parallel there between Luigi Mangione, which some hail as a hero, and in some cases, the murderer of Charlie Kirk, who, again, some hail as a hero.
Dr. Soliman, I want to get us back to maybe the medical side of this conversation a little bit here. What role, if any, do you think that insurers and providers, as well as policymakers, what role should they play in maybe rebuilding some of the public trust before that frustration with the healthcare system kind of boils over into something that is eventually very dangerous?
So, if you look at the last year, there was two pieces of legislation that had come out as a proposal from the Trump administration. One of them was the Big Beautiful Bill. In that piece of legislation, there was actually a provision there for trying to curb the middlemen, and from my perspective in healthcare, the pharmacy benefit managers, which really helps to drive up the cost. I've talked a lot about this, but they're the real folks in this healthcare ecosystem that are driving up cost. So I think we have to figure that out. We have to figure out how we curb drug prices, how we streamline access, how we're going to use AI. One of the things that UnitedHealthcare, for example, was criticized about was they were using the AI algorithm to deny more claims. Meaning the patients were going in to get their medication, to get their surgeries, to get their tests, their MRIs, CT scans. They were getting denied more so with this AI algorithm. So I think also leveraging technology and how we're going to do that and making sure we don't manipulate that so that it benefits the company in terms of profit versus what it's supposed to be doing ultimately is to benefit and streamline patient access. So patients are frustrated. I get it. I understand. Our organization, the ACMA, that's what we do. We educate prior auth specialists, people that work in reimbursement to help reduce prior auth denials. And so I think we have to figure that out. I think education plays an important role, and we've seen actually by educating people in prior authorization, you can significantly up to 50% reduce denials. So I think that's a big component, but I also think reducing the administrative burden through some type of policy reform is going to be important. This week, I'm going to actually have on my podcast, the Will Soliman podcast, the president of the American Medical Association. And we're going to talk about this issue because for physicians, it's a major burden. It causes the healthcare system billions of dollars a year in added costs.
So if you could send maybe one clear single message to both sides of this, we're talking about the lawmakers and the general public, as well as maybe the medical community, about these recent tragedies and some of these healthcare frustrations, what would that message be?
I think both sides have to come to the table with a spirit of empathy, a spirit of reconciliation and compromise, right? Whatever the situation is, I think when you come at it with a spirit of reconciliation, compromise, and you have the right intention to be able to peacefully resolve the matter, that's the way it should be, right? And that's really the American way, and that's really what this country is built on.
All right, Dr. William Soliman, the CEO of the Accreditation Council for Medical Affairs. Thanks so much for your time this afternoon.
Thanks for having me.